Hi, my name is Ariel Vincent, and I'll be performing the focused assessment video. First, I'm going to start off with the 8 pre-procedural steps. First, I would check the patient order sheet. Next, I would gather any supplies and equipment that I would need. Then I would wash my hands. After that, I'd put on proper PPE, which would be gloves. And then we're going to go in and introduce ourselves to the patient and make sure that they're the correct patient. So, hi, my name is Ariel Vincent. I'll be your student nurse today. Can I get your name and date of birth?
Angela Locksmith, 030295.
Wonderful. Let me check real quick. Okay, then I would make sure I tell my patient what I'll be doing. I'll be performing a focused assessment, and I'll go ahead and raise the bed to the appropriate height. So now I'm going to ask you a series of questions. I ask all of my patients, can you tell me who the president is?
Donald Trump.
Donald Trump. Can you tell me where you are right now?
The hospital.
The hospital. And then can you tell me what day it is?
Thursday the 16th.
Okay, this tells me that my patient is oriented ×4. And could you also tell me why you're here today?
Shortness of breath and I have a cough.
Shortness of breath and have a cough. Okay, so we're just going to start off first with the pupils. Could I get you to stare at a spot on the wall for me? That's right. Okay, that shows me that her pupils are equal, round, reactive to light, and accommodate consensually. Next, I'm going to check her mucous membranes. Can you lift your nose up for me? Good. Can you smile? Say ah. Good. That shows me that her mucous membranes are pink and moist. And I'm going to go into my focused assessment, which is going to be respiratory. She said she had a cough and shortness of breath. So first off, for the lungs, on the right side, the right lung, you have a upper, middle, and lower lobe. The left side of the lung, you have a superior and inferior lobe due to the positioning of the heart. In inspecting the patient, I inspect that her chest is symmetrical. Normally, in a hospital setting, I'll remove the gown to inspect the chest, making sure I don't see any scars, any lesions, any masses, nodules, or deformities. I also notice that my patient's, her respiratory rate is normal. I also notice that she has no labored breathing. I don't see any respiratory distress. I don't see any nasal flaring or any retraction of the intercostal muscles. I also do not notice that she's tripoding to breathe. Could I get you to stand up for me, please? Make sure. And so this way, I also noticed I would inspect the front of the chest, and also I'm going to go ahead and inspect the back of the chest, making sure that there is no masses or lumps or nodules. I'm going to go ahead and do my AP diameter, making sure that it is 2 to 1. To 1, good. And could you give me a deep breath in, please? Deep breath out. I notice that her chest expansion is normal, and I also note that her spine is midline. I'm going to go ahead and palpate the back. I'm going to start off doing tactile firmitus. I'm going to ask my patient to say 99 as I move my hands down the spine of her back in 6 spaces. So, go ahead for me.
99, 99, 99, 99, 99, 99.
Good. This shows me that my patient, there's no fluid in her lungs. Also, while I'm back here, I'm going to go ahead and palpate in 9 spots on the back, doing this, using this form. I'm going to note that there will be dullness that replaces resonance where fluid or solid organs are present. So I'm going to go ahead and 3. Okay, I feel dullness in all of those areas. And since we're already back here, I'm going to go ahead and auscultate, listening to her lungs in 9 spots as well. And normally, I would have my patient take a deep breath in and out on each position that I'm going to be listening to. Good. I don't hear any adventitious sounds in the back, so no crackling or wheezing. Now, could I get you to turn around and sit on the bed for me? And I'm gonna go ahead and listen to the 5 spots anteriorly. And I also do not hear any wheezing or crackling in the 5 spots in the front. So after auscultating her respiratory, I'm gonna move down to the cardiac. I guess I could have kept these on. I'm gonna listen to 5 spots in the front. And she has normal sounds in all of those positions. And now I'm going to move to the abdominal portion. I can go ahead and get you to lay back, please. So first I'm going to inspect the abdomen. Normally I would ask my patient to remove her gown in a hospital setting, but I would inspect and make sure I don't see any scars, any lesions, or nodules or deformities. Then I would auscultate, and I would start listening from the right lower quadrant. And I notice that her bowel sounds are normal. Could you also tell me when you had a last bowel movement?
This morning.
This morning. And have you had any problems voiding?
No.
No? Okay, good. Next I would go into palpation, and I would start from light to deep touch. And did you have any pain with that? No? Good. So now we're going to move on to the skin. I noticed that her skin is all the same color. I noticed that her temperature is warm. Her turgor returns to baseline in 1 to 2 seconds. I know that there's no scarring, there's no lesions. For her capillary refill, let me see this, okay. It returns to baseline in 1 to 3 seconds. I'll go ahead and do upper musculoskeletal strength. Can you do grip strength? Good. And then can you also move your arm up and to the side? I notice that her strength is bilateral in both sides, and I also notice that her range of motion is normal. I'm gonna go ahead and check the radial pulse. I feel that it is 2+, and I'll check that bilaterally. I'm gonna move down to her legs, noting that, first off, I'll check. There's no edema in her upper extremities, and I'll also check that in the lower extremities. I don't see any edema in her legs. I also notice, I'm gonna check her pedal pulse, noting that it's 2+. I would do that bilaterally as well. I'm gonna check her cap refill, making sure that it is normal. Then can you push up on my hand? Don't let me push down. Good. Same with your foot. Good. I noticed that her reflexes and her strength are normal as well in her feet. I also noticed that she doesn't have any wounds, so she doesn't have a drainage bag or anything like that. We checked the edema, we checked the skin and the turgor, and so that completes the rest of the assessment. I would then raise my patient's bed to the appropriate height. I would make sure that I put the call light within reach and make sure that I let her know, well, first off, put the bed rails up on the sides as well, and I would assess my patient. Do you have any additional needs? Okay, I'll be back in about 30 minutes to check on you.
Okay.
Then, when I'd be finished with that, I would go and I would remove any PPE, so take off my gloves. I would clean anything that I used to touch the patient. Then I would wash my hands, and afterwards I would document. I would document the date, I would document the time, the procedure, the assessment, and any of the patient's complaints or anything to the assessment.